Hi guys, my name is Hannah Creelis. I'm a student physical therapist assistant here at Jeff State, and today I'm going to be talking to you about telehealth and physical therapy. So the reason why I chose this topic is because of the coronavirus. The coronavirus is limiting us to go into clinics. It's limiting us from seeing patients seeing us as therapists. And so this telehealth is a platform for physical therapy world to use as a way to reach those patients who can't come in and see us, and we can't see them because of safety issues right now. So some of the facts I want to give you guys, according to the CDC, not meaning to scare anyone, but there's over 300,000 cases of the coronavirus in the United States. And with that, they're limiting, only essential personnel out, and physical therapy is a part of those essential personnel, but in the hospital. So clinical or outpatient clinics have kind of been hit with a decline in patients coming in, which is great because they're practicing social distancing, but at the same time, those patients aren't getting seen. So I'm going to throw two more statistics at you, which I'll explain in a minute. In America, there's approximately 124,000 people who have a musculoskeletal condition. And apart from that, there's about 4.5 billion people who have access to the internet. So with all three of those taken into account, this opens up the platform for telehealth. So with more people having internet access, the more people we can reach. The more people who unfortunately have a musculoskeletal disorder or condition, that opens up more opportunity for them to be seen. And when in light of the coronavirus, this limits our patient interaction. So this is just another way for us to reach them. So some of the focal points I'm going to be talking about is, what is telehealth? How does this affect the PT world? What type of patients we're going to be seeing? How does insurance come into play with this? As well as, some of the questions asked, is the level of care being altered? And I'm just going to list some of the pros and cons I think are best. So telehealth, according to the definition online, is use of electronic information and telecommunication technologies to support long-distance clinical healthcare. I do want to point out there's a difference between telehealth and telemedicine. Telemedicine is more specific based on providers, and telehealth is more broad, and that's where physical therapy lies. So there's three types of models for the telehealth system. The first model is the live video or synchronous platform, which is the real-time two-way interaction between the therapist and patient or caregiver. And this is just a great alternative to on-site visits. So we can be in the living room with them and teach them, educate them certain exercises or stretches that need to be doing. Next, we have store and forward asynchronous model. And it's just a pre-recorded materials uploaded onto an app or a website that patients can have access to help them whatever issue or condition that they might have. A great example of this is that UAB uses this website actually, and it's medbridge.com. Many of you probably already know it. I think it's a great tool for patients to use for a home exercise program, and it gives them live videos and pictures and step-by-step process of what they need to be doing. Next, we have remote patient monitoring. This is a great platform for those patients who need constant monitoring through their vital signs. So patients with chronic conditions like diabetes or heart conditions or blood pressure issues, this can give them or the providers live feed or source of their vital signs throughout the day. One of the physical therapy systems is called the VERA system, which stands for Virtual Exercise Rehabilitation Assistant. And this is awesome because this basically tracks your movement through the video. It gives them the PT live results of what's going on a computer level, and this helps the PT see it on a computer level as well as a visual level to assess what's going on, which is awesome. Next, we have how does this affect the PT world? So this is basically just opening up the PT world to virtual physical therapy, which is just another tool in our toolbox that we've been trained to have. I mean, this is just another opportunity to reach more people and to help those who otherwise can't come in, regardless of the coronavirus, people who otherwise wouldn't go to therapy because it's too far, or they don't have the money for gas to get there. So this is a great opportunity for us to reach those type of patients. Plus it challenges us because, we're not using our hands. We have to think through what's going on. We have to communicate. And so that challenges us as therapists as well. So the type of patients that we're going to be seeing is every type of patient. Any type of patient who comes in for an outpatient clinic, we can see, other than the modalities and manual therapy, we're going to be seeing patients who have orthopedic issues, neurological issues, or chronic conditions in the geriatric population. So, that's who we treat regardless, and so this is going to open up the door to treat more of the geriatric populations that aren't being served with physical therapy already. Next, interventions that we might be able to do, of course, is exercise. So stretching, range of motion, strengthening, and a lot of that is education. Our job is to educate patients on how to do things, why we do things, and when to do things. And so education is going to be a key component in everything we do on this platform and in real life. So it's just another tool in our toolbox. So we can also do therapeutic activities, therapeutic procedure type exercises or activities, as well as self-care and home management training, which is cool. So medical interventions is kind of a gray area for this topic because it's not a specific pathology. But I did want to touch base on, telemedicine and telehealth are different. Telemedicine, again, is more of e-visits or checkups through or to your doctor, nurse practitioner, or their PA to kind of update them or update yourself on what we need to do. But a lot of questions get asked with telehealth and direct access as far as, do the therapists know when to tell the patients to seek medical help or medical intervention? And from day one, PTA and PTAs are always taught to, if something doesn't look right, don't touch them, or if something doesn't add up, advise them to go see someone else because you don't know the answer, or you think that they will have the answer for them. So a lot of that is, just being competent in what you're doing and being ethical. A lot of this has to do with making clinical decisions and making sure they know and what's going on. So it's a broad topic, but we just have to know when to let them know that they need to go seek more medical advice. So insurance is a huge topic and ever changing, so there's not a lot I can say that won't be changed tomorrow, but I can kind of give you the updates. So according to Blue Cross Blue Shield in Alabama, on April 2nd, they have opened up their coverage for telehealth through physical therapy and occupational therapy. So a lot more people can have it now. And again, as of today, tomorrow, April 7th, they're going to start with Medicaid allowing telehealth communication for physical therapy. So that's great. The last thing on the list is Medicare, which is always a gray area because there's so many ups and downs, changes that we constantly know. So as of right now, nothing's changed. We can't see or get reimbursed for those visits. Some of the changes that were made on the Blue Cross Blue Shield telehealth for Alabama was different coding. They'll have different codes for the telehealth charges, as well as they require it has to be audio and visual technology used, as well as the visits won't change. So if you have a telehealth visit, it will be the same as going in person. So the last question is level of care. Is that going to be altered? And I have a list of things that why it shouldn't, but it's the most asked question. But it goes down to the therapist, and the standard of care doesn't change. It's just the method of delivery that we have to take that in perspective. So nothing, your ethical decisions or competencies shouldn't change based on how you're delivering it. Some of the pros and cons, I'm a little biased. I think this is a great tool to have. The cons, of course, is there's no manual therapy and manual or modality, so that's going to limit some of our patient population. So if you have any questions or concerns, let me know. There's so much stuff that's changing, so there's so much more I have to learn too. But let me know if you have any questions. And here's my references. Thanks.